I'm going to tell you a little bit about Jason. Jason is a physician, Jason Hayes, and he ran for lieutenant governor, the state of Georgia, and lost his nomination. But I voted for him and I supported him. And one of the reasons I did was because he was a fellow physician. And I think it's important for us to have doctors as representatives such that we can make certain that healthcare, health access, patients, and physicians are well represented. Let's see. Jason on now. Jason, are you on? There you are. How are you?
Yeah, I tried to come from my desktop, but it didn't work. So
didn't work. I guess
yeah.
I didn't catch that. It's got to be on your phone. So we've got some people on. And I'm just doing an introduction, but I'm going to let you introduce yourself. But I was letting people know how I got to know you and why it's important. And so it just started with Jason. Ran for lieutenant governor here in the state of Georgia. I voted for him. He asked for my vote. I gave it to him. It's very important, I think, for physicians to be to have some representation in politics, and physicians of sound stature. We can see with everything that has gone on with COVID that politics really invades it, and people can have very false scientific platforms, and also use sometimes their credentials or false credentials to sort of further an anti-science agenda. And not only is that dangerous, it really can feed all types of things like even terrorism and terroristic threats. When we think about biowarfare and people not believing what's being said. So I wanted to have Jason on because I want to talk about why that's important and what kinds of platforms we need to look at. So Jason, I'm going to have you just introduce yourself.
Hey, hello everyone. My name is Dr. Jason Hayes. Recently, as Dr. Morgan was saying, I was a recently Democratic candidate for lieutenant governor right here in Georgia. And just a small bit about myself. Grew up in Louisiana. Went to Xavier University in New Orleans, Bachelor of Science in Chemistry. I ended up going to Meharry Medical College, where I got a Master's of Public Health and also a medical degree. Did my internal medicine training at Baylor College of Medicine in Houston. And then for about 4 years, ended up working with the National Health Service Corps, working in underserved communities. Did some work around the country as a travel doctor, settled in the Atlanta area in 2015. Ended up actually have my own medical practice that I started in Alpharetta back in 2017, 2018. 2020 ran for state rep in Alpharetta, was a Democratic nominee for that position, House District 49. Almost flipped it. Had the best showing in any Democrat in a Republican district, so then decided to run for lieutenant governor back this past year in 2022. And even though we didn't get the nomination, we did have a great experience getting a chance to meet people across the state of Georgia, and also having an opportunity or a platform to get across about healthcare, education, also making sure that we have economic growth in all of our communities.
Yeah, Jason, when, obviously you ran during really the height of this COVID pandemic, and I have been working to really make certain that people can be educated and informed and knowledgeable about COVID, but about science in general. And in doing so, we've run into a lot of the anti-vaxxers, anti-vaccine advocates, not just anti-science, people who work to undermine and discredit scientists, including people like Dr. Fauci. And we find that these people have very large platforms, right? And they have a lot of followers. And what we learn on social media oftentimes is that people align themselves with people who think the way that they do. And so it's very hard then to get out of that, to have an open mind and begin to listen to other information, even if it is sound science. The other thing that I found that sort of the anti-science community does is it uses pseudoscience, meaning false science, to justify and further their points. And the general public doesn't really understand the difference between pseudoscience and real science, and it all sounds the same. And so that allows them to further their point. And, you know, when we look at representatives like yourself, people then who have the ability to have a platform, to have a big following, and to also sign on to legislation and to move things forward, it's incredibly important to have representatives who are actually representing science and who understand it.
Absolutely. So what it comes down to is credibility, and then also individuals not really looking into what's going on. And most of the people about the issues, and then also we have a polio outbreak, or just individuals who just don't understand science, and the people that they're looking to for their information aren't individuals who actually have that background in the science. So it's unfortunate with the COVID-19 situation became very political, especially with former President Donald Trump, with some of the rhetoric that he threw out, and then other people like pseudoscience people like Seth Rogen with their own TV shows, radio shows, just saying things. And for a lot of people, it's out of sight and out of mind. They didn't believe in COVID. They thought that people were faking. And I said, well, okay, well, I said, why don't we bring you to if we can, bring you to the hospital and show you in the ICUs that people are dying from it. And so people, in a lot of ways, it's their own fear of mortality and their inability to actually see that there are things out there that can harm you. And, you know, again, people took it to a political level without really trying to understand the science behind the thing.
You know, recently I worked with the Autism Society, and if you all aren't familiar, autistic children for several decades now have really been undermined with their immunization efforts by pseudoscience, meaning that, let's say we start with well-meaning parents who have read misinformation that is really pseudoscience, this false science, which actually looks very scientific, and said that, you know, vaccines were actually causing autism. The reason their children have autism is because of the early childhood vaccinations, and they began to refuse vaccinations for their children. And this movement over time grew, despite the fact that paper after paper after paper was published refuting this theory. It caught hold because what happens is people tend to believe things that fit in with their line of thinking, and it's very hard to break that. There are very few people who have the ability to break that. Generally, people in leadership positions have the ability to lead and break that thinking. People that are celebrities that people tend to idolize also have the ability to break that type of thinking. And that's why it's important. Generally, scientists are not celebrities, right? Nobody's idolizing us. We don't have big followers. Millions of people aren't, you know, running to see what's going to be the next advance in DNA technology. It seems boring. It seems disinteresting. It seems complicated. It seems hard to understand, right? And so people don't really follow it. We don't have these big followings. And then therefore you don't have the voice. And that's why it's important for people to run for office and get elected such that we have that voice and that platform such that people can start to listen, because otherwise doctors don't generally have that platform. By and large, we're out seeing patients. We're in the community. We are in the hospital. We're practicing our craft. We dedicate our lives to science. And in doing so, it's hard for us to understand that people could think that we would dedicate our lives to doing something that would harm other people. And so this is one of the reasons I wanted to have, you know, Jason on, Dr. Hayes. I'm calling him Jason. He calls me Jane, but this is Dr. Hayes, to make sure that people actually know who he is and understand how important it is when you see the credentials and MD, DO behind someone's name when they're running. Think twice about that. But you also have to be concerned with, we've seen doctors actually do harm, right? and use
Absolutely.
their credentials to do harm to further their own personal agendas. And it's very hard to sort through that. I try on Stairwell Chronicles to make sure that anything you see here is the truth. And it's been vetted, and it's been vetted by me. And I know that it is sound science. So that's one of the reasons we have Jason on. Go ahead.
Absolutely. Well, and one of the things that when I ran for office is that I told Democratic Party and the Republican Party is that, you know, I'm not here for a party, I'm here for people. And I said,
and I want to be clear, I'm not here for a party. I'm bringing Jason on because he represents sound science. I did vote for him, and I think it's important for science to be represented in legislation. So absolutely.
Absolutely. And when you say it like that, then, you know, it takes the political aspect out of it. Like Rand Paul, excuse me, that's over in Kentucky. You know, here's someone that's an ophthalmologist, made up his own board so he can become board certified. Pretty much going tit for tat with Dr. Fauci, who's an infectious disease doctor. So if I'm in the hospital and I have a patient that's sick with an infectious disease issue, who am I going to call, the ophthalmologist or the infectious disease specialist? So,
but you might call the ophthalmologist in this era, because this may be the person who's in legislature, right? He's in an elected position, and he's got a big following, and so people value what he says and agree, obviously, with what he says as well. And so you actually might find yourself following someone who's pushing pseudoscience, especially if they have credentials. And so that's why I want to make certain that when we're here, we know that we're talking only about science and not personal agendas.
Absolutely. And that's the whole point. You know, someone like Rand Paul was pushing the agenda of the Republican Party, or the Trump Party, as opposed to pushing real science, or just being frank with everyone and saying, you know what, I'm not an infectious disease specialist. We need an infectious disease specialist. If I have questions about it, hey, let's do the research. Let's make sure whatever articles that we're presenting is randomized, double-blinded, coming from a reputable source and everything. So, you know, making sure that we get the right people involved in making decisions is critical. And then also, as you mentioned before, making sure we have the right people who have a seat at the table, who understand the science, who can actually make sure that they can get that information to those who are making decisions.
Yeah, absolutely. Absolutely. So I, 100% appreciate you coming on today. I wanted to make certain that people have the opportunity to see you and to know that there are doctors who are doing the right thing and are trying to move the state of Georgia, the country of the United States, the world in the right direction. Anti-science kills. We've had over 1 million people die from COVID, and over half of those deaths were needless deaths because they occurred after vaccinations became available. There were so many unvaccinated people who died. That is such a tragedy that really has yet to be written and really examined in a very in a very distant way, by somebody being very objective and just talking about the deaths that occurred and what does that mean. And we can have the same thing when it comes to bioterrorism warfare. If people don't believe it, if people don't understand it, if they're following other people with different agendas, then the society as a whole can't move forward in a collective way to protect ourselves. So it's incredibly dangerous, this entire anti-science movement. I want to do my part to make sure you always know where you can come for just the science information.
Absolutely. You know, again, for a lot of people, it's out of sight, out of mind. You know, polio we had a big time polio outbreak or issue back in the 40s and the 50s. And then after people became vaccinated, you saw pretty much an eradication of it. But now with this anti-vaccine movement, you're seeing people now with polio having an outbreak in New York. So, you know, again, it's a shame that a lot of people aren't following the science, or at least trying to listen to those who have the experience in the science. But eventually, you know, we'll get people on the right track.
Bingo. We see polio because of anti-vaccine efforts. That's right. And now we're seeing polio back. Most people under the age of 50 really have never even seen polio. Doctors have never treated it in the United States because of vaccines. And I'm not here really to promote vaccines. I'm really here to make certain that people understand the danger and the threat of the anti-science movement and how important it is to make certain that we have vetted, sound, scientific people of integrity in office. When you have an opportunity, make sure that you seriously consider candidates who are serious doctors and not furthering personal agendas with, all of the other things that Dr. Hayes talks about.
Right.
Sometimes it's hard to determine. That's why I'm here. Send me a question. I'll let you know who's real and who isn't.
That's right. Absolutely. Absolutely. Yeah. We appreciate the efforts that you've been doing.
Yeah.
System and talking about COVID and making sure people understand that, COVID's not over with. It's here. We still have to wear our mask and make sure we get vaccinated, get your boosters, washing your hands.
And remember the monkeypox, just for a second, when we're talking about monkeypox, talking about men having sex with men, but definitely here in the state of Georgia, South Carolina, other states, the majority of this population are African American. So we're talking about ourselves. This begins to leak into the population and into the greater society. Do not ignore it. Do not say it can't be me. It continues to impact disadvantaged populations, vulnerable populations. It's why we must have representation in legislature to make certain that we can have health equity and equal access, such that when we have these plagues and these infectious pandemics that come through, we are not always the ones who are targeted because we have the fewest resources.
Absolutely. And that's important to note that when we're dealing with healthcare disparities, we're talking about underrepresented patient populations, whether if it's Black, Latino, poor whites, individuals who are lower in the socioeconomic status.
Children, people with autism, people with disabilities, everything, mental health.
As well.
That's right.
So, making sure that we have individuals that speak, to their interests and make sure that we hold political leaders accountable for those who are the voiceless.
Absolutely. Thank you, Jason, for coming on tonight. Thank you for pivoting to your phone. You were all set up on your laptop. I should have told you.
Yeah, it's okay. Sometimes the laptop is a little better. You can get better views and better lighting and stuff. But it's okay. We got these fancy iPhones and everything.
Right.
They can help us.
All right. I'll see everybody. Good night. Thanks for coming on.
Appreciate it.
See you, Jason.
Right. Bye-bye.
Bye.